Welcome to the First Nations Health Managers Association's weekly town hall. Over the next hour, we will provide an update on the COVID-19 pandemic and then focus on what we can do to close the 87,500-hour life expectancy gap. Join us as we speak with health professionals, subject matter experts, and Indigenous leaders. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crow.
Tansei from the traditional territories of the Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron, and many other diverse nations. We are broadcasting live from the NationTalk studio in Toronto. As you heard, I am your host, Marion Crow from Paipa First Nation in Saskatchewan Treaty 4 territory. Happy to be joining you in your homes, your territories, your nations and organizations. Thank you for getting your credible, reliable information here at the First Nations Health Managers Association Weekly Town Hall. So, some of you know we've been transitioning a little bit, the show topic. So, we were bringing you all of that COVID information. We're still doing it thanks to our partners at Indigenous Services Canada, but we've been transitioning a little bit on how to get back the 87,500 hours. That's a lot of hours, folks, that we don't live next to the Canadian population, 87,500 hours less than what our friends do in the rest of Canada. So let's unpack how we close the gaps. And today, we're going to focus on food security and food sovereignty. We have an amazing panel of guests for you today. But before we get into the show, I want to do a quick nod. I don't know if you guys know what this means. This is a Cookum scarf. So I do want to say that we stand with Ukraine. We try not to get into politics in this show, but right now we know that the world needs to put our arms around Ukraine. This is a Cookum scarf. And when the Ukraine people immigrated to the prairies in Canada, they brought with them babushkas in some terminology. We call it the Cookum scarf because of the beautiful flowers on it, right? And so we just want to let you know, thank you for your friendship, Ukraine. I wear this to support and lift you up in this time of need. All right, let's get back to the show. I want to thank Dr. Ibrahim Khan, Indigenous Services Canada partner, for helping us unpack some of those epi-stats on COVID-19. Dr. Khan, do you want to unmute yourself and come on in to the crow's nest, Dr. Khan? Welcome back.
Thank you so much, Mary, and hope you can hear me. Thank you so much for your warm welcome, and good afternoon to all the panelists and all the audience. You have been the best host of these shows, and I'm really happy to be with you. So thank you so much for this invitation. First of all, I would like to acknowledge that I'm joining from a beautiful, amazing Territory 4 in Saskatchewan, which connects me and Marianne and many others very, very tightly to our land. Thank you so much. And I think that land acknowledgement, that people acknowledgement is really, really critical for our commitment to close the gaps in the healthcare services, but also to improve the outcomes and pay more attention to the health of Indigenous people. I also want to thank all our nations across the country, all our chiefs, all our health directors, everyone who has contributed to the response, and the world has seen how our chiefs, our health directors, our healthcare providers, our frontline staff have responded in the last 2 years of day and night tireless efforts of this response to pandemic. So I want to commend that, and I want to say that without that, I would have not been able to do anything with their support. So thank you so much for all that. All the information that I'm going to be sharing with you, I know my time is very limited, but I would like to touch on a couple of really important points in terms of COVID national response, in terms of COVID national situation, and then drill a little bit down, particularly on the Saskatchewan province and also our Saskatchewan First Nations communities. All this information that I'm presenting to you has been prepared and approved by our chiefs of Saskatchewan. We have been very closely engaging with our chiefs, our health directors, our education directors, our frontline healthcare staff very closely. Every week, we have been providing them EPI updates, vaccine rollout, every single aspect of the response. We have been sharing that with our chief and taking their strengths, wisdom, and intelligence into the response to the COVID situation. So I want to mention that. I just want to mention a couple of really quick points on the overall national picture of Saskatchewan in Canada, particularly. So thankfully, most of the provinces across Canada are beginning to move past the peak of the last wave, and which was very, very deadly, very infectious, very one of the deadliest variants of COVID, which was the Omicron, has some severe impacts on our nations, our people, families, and individuals. So certainly you are seeing a transition among all provinces. We do still have some elevated levels of COVID-19 in the Omicron situation in some provinces, some territories, depending upon where you live and how the vaccine uptake is. It's very visible and telling the COVID-19, particularly transmission in communities. In addition to the wisdom, strength, and resilience and exceptional leadership response that have been provided to in this COVID pandemic, we were also very fortunate as a scientific communities, as a global communities, as a family, as a healthcare provider, that we had some really astonishing things happening in this pandemic. First of all, the unified front globally and here in our nations was tremendous. Also, the scientific achievements, particularly the vaccine and the basket of vaccine that have been available, that have been so effective in reducing the COVID transmission. Certainly we're very fortunate to have the access to those wonderful vaccines around the world, and particularly in Canada, our communities had plenty of the vaccine available and still available and will be available throughout this coming months. So certainly you see the response from each province is very different. In Saskatchewan, our response was very different. Our COVID mandate, COVID particular protocols were very different than many other provinces. Certainly we can talk about that later in the presentation. But across the country, the data that was reported by FNHMA regions to Indigenous Services Canada nationally have been presented very regularly on this forum and many other forums. The rates of COVID-19 have been very high among our First Nations population particularly. And the higher the burden of the First Nations community is rather pronounced in the last wave, particularly the fifth wave when Omicron hit the country. Certainly the number of deaths and hospitalization was another very remarkable feature of this pandemic. The increased rates of deaths in our First Nations communities, high morbidities, risk factors likely was the contributing factor to these unfortunate and preventable deaths, which also speaks to the importance of the high vaccine uptake in our First Nations communities to minimize the risk of severe outcomes such as the death to the possible extent. Particularly when it comes to hospitalization, ICU admissions, in Saskatchewan, certainly our rates of hospitalization was 1.8 times higher among Saskatchewan First Nations communities compared to the general Saskatchewan population. And the rates of deaths, unfortunately, were 1.9 times higher. Certainly that was a very remarkable feature. Also, when you look at the data of the rates of hospitalization were were even higher among 60 to 79 and 80 plus age groups. So certainly those age group were very, very dramatically impacted, and certainly had a very severe outcomes had to face by the family and the individuals. As Marianne very nicely mentioned, that all of us are transitioning in this pandemic from a pandemic state to transitioning living with COVID. So certainly the response is changing the way we look at COVID, the way we follow up on COVID cases. So certainly in Saskatchewan, we have switched very smoothly to follow up on severe cases and hospitalized cases, and particularly deaths. So we do watch those information very, very closely, and we watch that information by very small area geography. We want to see where are these deaths and these hospitalizations coming from. Are they vaccinated? If yes, how many doses, how many of them are 2, how many of them are 3. So all those information will be very critical moving forward. Just want to share with you the tremendous efforts that the communities have put into reaching the state currently we are in. So in Saskatchewan, we still have a lot to do. Saskatchewan has the 4th lowest booster dose coverage among provinces in Canada, and particularly for currently stand at 51%. Those age 18 plus. Booster dose coverage in Saskatchewan First Nations communities remain low at 25% for those age 18-year-old and plus. 5 Saskatchewan communities have achieved 50% or greater vaccine uptake among the 18 plus for booster doses. Also, 27 Saskatchewan First Nations communities have achieved 85% or greater vaccine uptake among the 5 plus population for dose 1 and 2. Saskatchewan First Nations communities have reached 70% second dose coverage in age 5 and older, and 79% second dose coverage in age 12 and older. Booster dose coverage remains low at 25% among those age 18 and older. So certainly our booster dose uptake is a concern, and throughout the coming spring and summer, all efforts and eyes will be on how we boost the uptake for the booster doses, which is really critical for the surge in the fall and later on any other variants that may come. Another very striking feature of this pandemic indicators and information I want to share with you is that the rate of ICU admission was 13 times higher in unvaccinated cases compared to those that had a booster dose, and the rate of deaths was 18 times higher in the unvaccinated cases compared to those that have a booster dose. So certainly it speaks to the protective effect of the vaccine that has been playing a big role. And certainly moving forward, we're going to be watching, as you guys know, a lot of focus was on the last the recent variant Omicron, BA1, BA2. Certainly BA2 is more in the focus because it's more transmissible. So a lot of eyes is currently on some of the European nations, and particularly Denmark, and how it's spreading currently in Hong Kong and Chinese population. So certainly that is there's a global watch on that. Currently in Saskatchewan, as you know, most of the public health restrictions have been lifted. So there is a lot of population mixing happening. People are starting traveling. People are coming together. Some are wearing those really good protective habits that protected all of us from flu and from COVID. Like wearing a mask, getting tested. Testing is widely available, but certainly the dynamics on testing has changed as well. PCR test is available to all our Indigenous people once they call 811 and disclose. So the PCR test is particularly available for those where high-risk setting, outbreak investigation, and those sort of things. But access to rapid antigen test has dramatically changed. So people have access to that testing. So certainly in the coming weeks and months, we're going to be watching how the population dynamics plays out, and certainly the global situation, certainly the war zones and global travel certainly can escalate all the successes that we have achieved achieved so far. And also the efforts for, keeping the focus on the booster doses, particularly the third doses in the coming months, are critical. We are in Saskatchewan are plateauing in a very high level. So there will be a lot of focus on that the health system is ready for any sort of possible surge. We do know in Saskatchewan where are our hotspots of low vaccine rates. And so there's a lot of focus, there's a lot of discussions with the chiefs. We are embarking on soon a boost into the spring campaign. And also our FSIN partners are coming with some incredible ideas for a very innovative, creative app that can really help people on the vaccine front, but many other health issues as well. So we're very excited for that particular announcement that FSIN will be soon doing. And we are working closely with all our chiefs, including the chief of FSINs and our tribal council and health directors, to keep that focus on the booster doses, testing, watching global dynamics, being informed, being aware what is happening around the world, so that we can protect and take the steps in a timely way to protect our communities. Certainly, some of the public health orders and restrictions are gone, but our advice from the medical health officer standpoint and from public health, best science and evidence is that we are giving advice to the communities and guidance to the communities where how their vaccine rates are, how their population dynamics are, risk factors, where are they located, access to care. So certainly every community, every tribal council is taking a very careful and cautious approach in terms of reopening. I know the world is opening up very quickly, but our First Nations chiefs are extremely wise, and they are very careful in terms of a premature reopen and quick reopen. So they have been advocating for that for all these day and night of the last 2 years, and they're still doing it. They are very careful in terms of reopen and how they can protect themselves. Everybody has learned a lot during this pandemic, and they want to keep those lessons learned in the view of coming months and how we deal with COVID. A lot of focus is also on the COVID-19 long-term impacts and how we capture that information. So Saskatchewan is a leader and champion in that regard. There was an app introduced, and we share all those information with our chiefs and communities that they can download that app and fill up that questionnaires and provide some insights into how we're going to capture the information on this, the short-term and long-term impacts of COVID. My last couple of key messages on this talk is particularly that we're working with all First Nations communities. We are giving them the best science. They are very up to date in terms of science, in terms of their community level specific data, vaccine rates, and they understand their risks, and they're taking appropriate steps. So each community will have a unique circumstances which will require a very specific plan. And recognition of those would be very important moving forward. Risk tolerance, watching where you're going, travel, risk-based travel, and boosting the third dose uptake in the communities. Certainly those sort of will be the key notions and the key focus for us. And certainly there will be announcements soon on the boost into the spring campaign and some of our tribal council specific, community specific initiatives that we would like to support and work very closely together with communities that happens. So thank you so much, Marianne, for this opportunity, and I'll stay with you if there are questions.
Dr. Khan, thank you so much for sharing the perspectives that you bring. We always appreciate the partnership that we have with Indigenous Services Canada, and you're no stranger to our show. I think it's your second or third or maybe even fourth time on, so thank you so very much for ensuring we continue to keep our nation safe. So Dr. Khan, I'm just going to ask you to mute now and stay with me because you know the drill. We have questions for all of our panelists, and to get those questions in, you can send them to FNHMA at ihtoday.ca. So studio, I know you want to go to a break, but I'm going to bypass the break. So just making sure my colleagues in the studio know I'm not going to go there. I do want to do a couple of shout outs as well. We have watching on air Susan, Manon, Dawson, and hey, Sue, Paul, Ron. I know you guys are watching. Thanks for getting your credible, reliable, and accurate information here at the FNHMA Town Hall. Now, Dr. Khan just set us up beautifully talking about how Indigenous Services Canada has been working so closely with the chiefs of Saskatchewan at the Federation of Sovereign Indigenous Nations. I used to work there back in the day, so I'm very excited to work with other chiefs as well. And on that note, Chief Kobenis is with us. How about this? I'm so excited. Dr. Kobenis, come on in to the crow's nest. Unmute yourself and share what you've been up to in Kenora, Chief Lorraine.
Bonjour everybody, watch Kwe Indigo, Piju du Tem, Nisachwan Donji, proud member at Treaty 3, always got to throw that in there, everybody's proud today. So I wanted to say miigwech for being invited to speak today on a lot of issues, and I just want to say, miigwech to all the panelists. You guys are looking good today. Right? Beautiful. Good day to be speaking. So my English name is Lorraine Kobenis. I'm chief of Nisachwan and Anishinaabe Nation here in Treaty 3. This is my 7th term as chief, so I've been around a little while. I have a beautiful community of 490 members, and we're just located 20 minutes out of Kenora. So I guess, we're here today just to speak about the issues of the 10-year gap in life expectancy of our people and some of those impacts to why that is. And I'm not going to speak because we have a lot of other people who are going to speak to some of the more medical type pieces and other work that's being happening. But I want to speak to our community, what we're doing and strategies, and be focused on solutions, right? Things that we're doing that we can share with other communities, everybody across Turtle Island. So one of the things I wanted to say is, the inequities to our overall health, right? That includes, diabetes, the cost of purchasing food, the cost of even just managing our own resources here in communities, right? The traditional, our harvesting, our wild rice, our fisheries, everything. There's always a cost to that. I'm not too worried because we're doing our own thing here, but those are some of the things. So the realities in our communities are that we do have those challenges to food sovereignty, to food security, even right down to the kind of the DNA of our bodies, right? Of how we have to adapt to, I'm going to say KD, but that's one of my favorites. People know that, but you know what I mean? Yeah. So I'm just saying, so our bodies are quite different, but even in terms of, geographical locations of where we are also provide those barriers. But saying that, right, Nisachwan is first and foremost, we've put a declaration when I first became chief of putting our kids first. And that means everything from building healthy communities to building healthy families. They're resilient, they're healthier, they have the resources they need to lead us in the future, right? So we lead by example here. So some of the things that we do is we work within our community, right? So we work within our programs like Ontario Works that can provide all those additional supports. Like I'm talking right direct supports to grassroots people. If you're in need, that's what you need. We'll go, we'll help you, we'll figure it out. One of the other things that we do, and I'm sure like everybody does in every other community, is our Meals on Wheels, our supper clubs, our things that, we can provide nutritious meals to all of our people, our elders, our kids, our youth, everybody under the sun. And we do that consistently, right? One of the other things that I'm going to share that we are so extremely proud of, and this is direct supports to our people, our kids, through Jordan's Principle. We have a very good workers here in our community that did applications that provide direct food supplement supports to every child that's on our community, every child that's off reserve, and they get a monthly supplement. And we've done that the past year. We just got approved for a current year right up to December. So for every child, there's a supplement there that says, if it's not enough today, you're going to have what you need to at least get the basics, right? And that's going to help. That's what we believe is building resiliency and helping them focus on other things, right? To their success. So a lot of that is what we're doing. And again, our traditional harvesting of monomen, fish, medicines, taking care of that, right? But also some of the things that are impacting a lot of that, which is why we have to study, is, who wants to talk about, right? We have to address it. It's climate change. All of those things that are impacting, the food security, the food sovereignty, right? So one of the big thing is that, through our healers, our elders, passing on that critical information, everything that they've lived, those learned experiences to our kids, so that they're able to take that knowledge and keep passing it on, so that we're not making those same mistakes again, right? We've learned and we can do things very differently. So that's a lot of things. And one of the things we can't ever forget is water. Safe drinking water. You know what I mean? It's not all just about what we're consuming, but water is a huge monster part of that. And being able to do that, which I'm saying, my community is beautiful. We're lucky enough to have that infrastructure here to be able to do that, which we won 2 years in a row a few years ago, having the best tasting water here in Ontario. Yay, we're proud of that. So one of the other things I do want to talk about too is how we've done this, is networking, right? So I'm going to shout out to some of the people who have supported us by helping us with shipments of food and bringing in medicines and everything else. And that's Ogima Wabitung, Kenora District Service Board, our WinHack, BIMOSE, Treaty 3. So collaborating with everybody and saying, this is what we need, help us. Right? And they did, they do that. But making sure it's continuous, because just in the context of COVID doesn't mean that these challenges and barriers and these inequities aren't going to continue on until we look at longer term type solutions, right? And I think that's where we come from with that. So those supports. But I also have to say that dealing with our health, food is one piece of it. Water is another piece of it, but providing those supports in community. That also has to deal with primary care, right? That deals with mental health, our well-being. And we look at things as Anishinaabe people here holistically. And you can't do one without the other. And that's so important. And then I'm going to go into what we're doing in terms of improving outcomes, right, for our people. And a lot of that has to deal with, community to community. That's my partner in Wajishkuningam and Wash Bay and Wabsamung and all my partners, right? Community to community. We need to be able to support each other. And that's what we do. We rely on each other heavily when we're in trouble, or when we're having the best day ever, or we're just want to have fun, right? Networking, sharing, communicating, that's key. And that's what we do well here. The other thing I want to say is nation to nation. That's Treaty 1 to Treaty 4 to, the provincial government to the federal partnerships, right? We need to start thinking on that level, because one impacts the other. And one of the more important things I do have to say is the partnerships regionally, right? That are in our region that, when we're in trouble or, like I said, having successes, I can reach out to my partners here in the area and say, this is what's going on. How can we collaborate? What can we do together so that we're focused on these solutions, right? And a big part of that is I'm so proud to say that we're involved in a partnership that's called the All Nations Health Partners. And we were one of the drivers in forming this partnership because, of the inequities in healthcare. And we said, what are we doing? We got to learn to talk to each other and work together for the health of all of our people in the region, right? So we developed the All Nations Health Partner. We moved on to developing an Ontario Health Team, which is so enveloped in solution-based, working together, taking all of those issues out of it and doing what's best for our people. And then to top it off, we're also, our communities are big in the area of the development of an all nations hospital. So that means putting the infrastructure of our way of healing, our sweat lodge, our medicines, our healers, our helpers, having them recognized in systems that just, you know what I mean? Marrying those two together that are actually going to improve the outcomes, right? But also have our food in those systems as well, right? Having a wild rice soup and the fish and everything else on their menus, and just a side note, I'm allergic to fish. I would have never survived if I was born 100 years ago, right? But I'm still here. And that's what we want to promote, is that being inclusive, working in partnership for the betterment of all of our people. And I'm so proud of where we are at. There's still a lot of work to go. And I'm going to take one more minute because a huge part of that is also making sure that our people are involved in the economic recovery of this country, of Turtle Island. And a lot of that means being involved in a lot of economic development, wealth creation, endeavors moving forward, and independence, right? We know what's best for our people. We know how to do that. And just taking the bull by the horns and saying, you know what, today we're just going to do it. I don't need anybody's permission. We're just going to do this because it's in the best interest of our people. But we will always make sure that we're going to build those relationships because that's what's important, right? Our kids are going to live together forever, and we need to learn to live harmoniously. And I can go on forever. I'm Anishinaabe from Treaty 3, so you got to kind of go like this and tell you, but it's all good. And I appreciate the opportunity to share our experiences and be solution-focused partnerships, relationships.
Chi McGwitch, Chief. You should have seen me. I look like a bobblehead the whole time you were talking. I'm like I was on a car dash. I tell you, it was amazing to hear such vision, leadership, and no wonder you've been reelected for 7 terms. Way to go, Chief. I lift you and your nation up. Thank you so much. All right, I'll just get you to mute, Chief. What woman tells a chief that? Sorry, Chief. That's not something I would normally do, but from Treaty 3 back to Treaty 4, I do want to say hi, Pamela. Hi, Ahmed. Hi, Colleen. And Megan, thank you for getting your credible, reliable, and factual information here at the First Nations Health Managers Association Weekly Town Hall. So we are going to go from Treaty 3 to Treaty 4, and now I am going to call into the crow's nest. I'm going to call in Dr. Robidoux. Now, Dr. Robidoux, come on into the crow's nest. Go ahead and unmute yourself, Michael. tell us about your perspectives of food security and sovereignty. Welcome to the FNHMA Town Hall.
Well, great. Thanks so much for having me and inviting me to participate in this really interesting and I think really important discussion. So thanks so much. I should start by positioning myself within this research. And I'm a settler scholar. I'm originally from Sudbury. I've been lucky enough to work with First Nations communities primarily in Northern Canada since about 2001. Interestingly enough, I started this project. I'm an ethnologist. I studied cultural practice, and my original work was actually studying hockey in First Nations communities. I was a former hockey player. I had buddies who I played hockey with in Northern Ontario, and there was First Nations hockey tournaments, and I was like, wow, what a cool project. I work in a kinesiology department. This is great. And so I'd go up to communities, and it was just such an amazing experience. But what I was really interested in very early, it was that when I would go up to communities, people would take me on the land. It would be one of the first things that people would do. It'd be, let's go ice fishing, or let's go hunting, or whatever. And I fished a little bit, but growing up, but I was never a hunter. So all this was brand new to me. And I don't know, it was just so eye-opening. And so it was really moving how people were bringing me in and showing me their experiences, which they so clearly cherished and valued. And so after 4 years actually of doing this work and traveling across the country playing hockey in communities, this is probably the best 4 years of my life. Actually, it was pretty fun, I have to say. But then, in fact, I was in the Kenora, visited the Kenora hockey tournament and Sioux Lookout tournaments. I mean, I know that area so well in terms of my time there. So big shout out. And so when I'm in a department where I'm again more the cultural side of things, but I work with people who work in physiology, nutrition, some in toxicology. It's quite a mix. And so when I would get back from the communities, I would talk a little bit about the kind of the crisis, I guess, with the challenges that people were facing in terms of, obviously traditional food is very important, but that there's real challenges getting access to it. And of course, we know that there's a lot of dietary related disease, especially primarily in northern communities, and access to healthy, nutritious foods. And so these are things that I was exposed to firsthand. So I developed a project that was supposed to be a community-based project where we were going to, with my biophysical science colleagues, we were going to develop a project where we were going to study the benefits of traditional food. We had a great plan. We thought this was true community-based research. We were going to document the food that was eaten, the types of what's involved in hunting, what's involved in fishing, what's involved in food processing, who does what, how much is brought in. And then I had my physiological colleagues, they were doing various kinds of tests on trying to understand, well, what's the benefits? What can we measure? Can we measure, any types of inflammation? Can we measure more obvious things in terms of diabetes or overweight, obesity? What can we find that's going to show? And we had one group that ate, this is an experimental, it was just really by lived experience, who ate more traditional food versus people who didn't. And we had our groups. And so we thought we were going to have this great kind of result. But what we found out, in fact, was that it was quite devastating in terms of the news that we found. We found that 1 in 3 people were diabetic. We found that there was 66% were obese, 96% overweight. And in fact, the only difference we found in terms of high wild food versus low wild food were those who ate more wild food had higher contaminant burden. So this was a terrible news. And we were reporting back to the community these results to a certain extent. And 2 years of work funded by Health Canada. It was a very elaborate project, especially elders at band council and elders in the audience who were, when we were presenting our results, were kind of like, we know this. We know that we have problems with diabetes. We know there's problems with obesity. We know we have a lot of health issues. And we also know that we want more access to traditional food, but it's very difficult to get it. And so it was kind of an eye-opening experience for me and my research group in terms of understanding what our role is as researchers, that community-based research isn't really coming up with an idea and saying, hey, I got a community partner, let's do it. It's really working in collaboration with communities, trying to understand, well, what do they actually want? And from us at the university, as academics, as researchers, what can we do? And so we really changed our focus for the past, probably now almost 14 years, trying to support communities in their local food initiatives. So some communities were looking to build greenhouses. Some communities were looking to do more intergenerational learning, taking kids on the land and focusing on that. Some were interested in infrastructure. So we were able to find funding mechanisms through, for example, the Canadian Partnership Against Cancer, which was a major, probably 5-year grant that we were able to get that provided real tangible funding to communities, and right across the country from Yukon through to the eastern parts of Ontario, all in kind of rural, remote communities where there's very, usually fly-in or boat access. These are quite remote northern communities, trying to help support what they wanted and what they envisioned in terms of their solutions towards building better food sovereignty and food security. And so I can go through, I know I don't have much time, so I don't want to go through all the different initiatives that were taking place, but some of the communities currently we work with in Fort Providence and Northwest Territories, in Wapakika, in Ontario, Casablanca, and the Moose Cree First Nation. These are our current community partners. One of the challenges, I mean, even for community partners, like we want to spend more time in community. It's the joy of the work. But it's difficult. I mean, to be, I live in Ottawa now, this is where I work. And, it's, if you're going to have community partnerships, you really need to invest the time, spend the time and be there. Otherwise it just feels, and with the pandemic for the past 2 years, it's been horrible. So other than Facebook and one quick trip in the spring or in the fall last year, I mean, that was for safety reasons. But one of the things that I guess I wanted to kind of, in my last 3.5 minutes or so, what I wanted to emphasize is, so we've been doing this for now, again, quite a few years, and it's very encouraging to see, the really incredible efforts and across the country, what communities have done, the food mobilization efforts. And it doesn't look the same. It depends on region. It's so interesting. If you're, more of a coastal community versus, interior, your food situation is much different. And so primarily I work, most of my field work is in this kind of region about probably 300 kilometers kind of northeast of kind of Kenora or Sioux Lookout. It's up in the more kind of fly-in communities up there. And the more north you go, you think it's, wow, these are small communities. In the south, people go, wow, they could just go out and get moose or get caribou or get whatever. There's fish all over. But in fact, there's tremendous costs associated with it. There's tremendous effort, tremendous knowledge. And a lot of that knowledge, has been lost. I mean, partly through residential schools, partly through forced settlements as a result of Treaty 9 in the region I work in. And it's changed the population. The demographics now are more centered in communities where they're really depleting their specific area, because what semi-nomadic people are now forced to try to draw food into these very high concentrated populations that never once was. And so to say, let's just live off the land, it's much more complicated than that. And so, in fact, in the fall, we did work with a Wapakika community just to learn about their food mobilization efforts during the pandemic, which was remarkable. Their resilience, what they did was truly an incredible story about the hunters going on the land every day for a year. All that they did, the risks that they took to bring food back during what happened to supply chains. And people were really worried when the pandemic first broke out. The labor, the women of taking the food, whenever, say, a moose came back, the work that the women did, sometimes 12 hours, 14 hours in the day in order to basically process the food, get it distributed to every single household, just remarkable. But what's the again, the pressures, if that's the type of food mobilization efforts, what are the pressures on the resources in the community? So we're really working with communities, trying to understand what are the energy requirements, what do they need to basically feed themselves? Because in fact, it's very difficult to rely on the land. If you're building gardens, that's a lot of produce. If you're actually going to meet real energy requirements of a community, that's a very, very difficult thing. And so we've been measuring, in fact, what are the energy requirements and how much energy does a moose provide? How many moose do you need to feed a community? How much fish do you need? And in fact, based on the estimated harvest yields of this one particular community of only 440 people in the North Boreal Forest, they're meeting about probably 8.5 to 9% of their actual energy requirements from all the food that they're bringing in. So that would mean either do they increase the harvest, which again, does that risk the population of their food resources, whether it's overhunting in terms of moose or whatever, which of course the community is very, very aware of and very, their resource management is, they understand what's going on. And so they're very sensitive to these issues. And how did they do that? The importance of market food and making sure there's got to be a subsidized, a much more effective way of bringing food that's nutritious and affordable to these communities, because clearly relying entirely on the land is not possible based on the shifts in populations. So I have 20 seconds left, so I know I'm going to end here because I just think it's there's lots of great people here to talk, and In fact, I'm enjoying listening to everything. So thanks again so much for having me participate today and be part of this conversation.
Thank you so much, Dr. Robidoux. What you have been able to explain in that little bit of time we gave you, I've never heard anyone speak so concisely about it. So, Chimagwich, for all of the support you're doing, I can't wait to connect with you when I'm back in Ottawa, in the beautiful unceded, unsurrendered territory of the Algonquin people. So, stay with us. I would now like to bring in our final guest. Last but definitely not least, come on in. You've been patiently waiting, Branavan. Come on in to the Crow's Nest and tell us, what have you been up to? I hear we have some possible solutions to this, so come on in.
Awesome. Thank you so much for having me. And it's a pleasure to be able to share some of the community projects that we've been working on. I know Chief shared a couple of the projects that she sort of promoted within our community, and also Dr. Michael has shared some of those food projects that he's been working on as well. So it's a pleasure for me to be able to share some of the projects that we've worked with communities across Canada. So I'll be able to share more about some of the projects like the one in Squamish Nation, Shishagwaning First Nation, Norway House Cree Nation, and many more. So what we've seen with COVID is a lot of the communities were forced to reconsider what food sovereignty really means, with supply issues, availability of fresh produce, and the increase of costs to procure those produce. The conversations around food were changing. And over the recent years, from my experience, food sovereignty and food security have always been a key component in a lot of the community comprehensive plans. So it's not a new discussion that we're having, but just the narrative around how to move forward with these projects has changed. So as the pandemic hit, we started to see a lot of the communities push out or roll out some projects. Like Chief mentioned, a lot of the projects were around immediate relief. So like supporting food banks, providing food vouchers, and even community sort of group buying to reduce the costs for community members. So we saw a lot of that. But ultimately what we see a lot of communities do is starting to explore, how do we grow food? How do we grow it year round, and how do we provide that to our community members? And can we explore other ways to make it also sort of an economic development opportunity? So as we started to engage in a lot of these conversations, we easily started to understand that a lot of the communities wanted to grow food year round. So as technology advances, our goal is to sort of help communities grow produce year round, commercially, locally, and more sustainably. So we've been working with communities from around 2015. So a lot of the times we worked initially with communities in remote parts of Canada. So communities that are fly and only, usually they tend to see a lot of the higher prices in food, freshness usually plays a part, and you walk into the grocery store and there's nothing left on the shelves. So we started working with a lot of the communities to sort of design a sort of technology that allows them to grow year and at a commercial scale. So you're able to provide a lot of produce to community members. So once we started implementing these projects, we started to get a lot of communities reach out to us that are right around urban centers or road accessible, as we say. And they were super interested in, how can we do this in our community? How can we start growing produce and sort of distribute that to communities? So that's where we started working with communities directly, schools within communities, nonprofits that represent communities, as well as even grocery stores that are owned by communities to launch these projects. So to date, the community projects in our network have grown over 1 million servings of veggies, and they're all grown locally, and they're all provided directly to their community members. So what we ultimately want to focus on is helping communities plan and set up and operate these hydroponic modular farms that allow communities to grow year-round. What we call a farm is essentially a custom-built insulated structure that uses hydroponics to grow various kinds of produce. So be it lettuces, kale, spinaches, and some communities are also growing more culturally relevant crops. Like for example, in Kuujjuaq, the folks in the community are growing mountain sorrel, which is way more relevant to them in their diets. And I've worked with nations in Alberta that are growing lilies, for example. So for us, it's to really understand what the needs of the community and be able to sort of grow those crops in a feasible way. So when we say hydroponics in the system, we say that ultimately there's no soil. So you're using water and nutrients to grow the plants, and you're providing light throughout the system. So you don't really need external sun. So that allows you to sort of grow year round, and it's all climate controlled. So if it's minus 45 in the winter, you're still able to grow it. If it's plus 30 in the summer, you're still able to grow. So all that sort of controlled. And when we say commercial, we're looking at being able to grow around 500 heads of produce every week. So with that sort of commercial output, we really have to focus on how communities set the project up. So how are we distributing it? So there's many ways to do that, which I'll share further. And in terms of the infrastructure, so what does a community need? So I've worked with communities that have put it right next to their school. I've worked with communities that have put it next to their band office. Ultimately, what you need is access to some water, so you can use an insulated garden hose to fill up the farm, access to power, some space, and then ideally having some internet connection as well, and then some space within the community to store the produce. So if you harvest some produce on Monday and you're distributing to the community at an event on Thursday, you're able to store some in the fridge. So what we've started to see within the community projects is a lot of focus around pushing towards food sovereignty. So focusing on how the produce is distributed ultimately, what kind of produce you need to grow locally as well. So in the planning steps, it's really to engage with communities and assess what the needs are. So some communities already have existing food projects. There's a sort of a food bank, a diabetes program, things like that. So we want to be able to incorporate that with the project and exploring the feasibility. Like Dr. Michael said, some communities have higher power costs, higher wages, access to different sort of resources on the ground. So being able to assess that and being able to plan out what the operating costs are going to be, and then ultimately looking at how the produce is going to be distributed. So for example, in some communities, for example, in Shishagwaning First Nation, they have a social program which allows them to grow, and they do food boxes, which is given out to community members. And then they also expanded their project where they have another farm which offers other communities in the region on the Manitoulin line into produce. So it becomes a mixture of social project as well as an economic development opportunity. So we're seeing a lot of that roll out as well. So from my sort of experience working with a lot of the communities, we've seen sort of three sort of key pillars to why a lot of the projects are successful. Having a local champion on the ground ultimately helps, having someone to work with within the community, having support from the community leadership, and then ultimately working with existing programs or departments in the community that have already established projects already. So working with the local school, for example, or the food bank, or an elders initiative. So tying into the community structures already. And what I want to share next is some of the sort of the key successes that we've seen on a couple of our projects across Canada. So for example, in Norway House Cree Nation in northern Manitoba, they have a sort of a system. They're able to grow enough produce for their local school. So it engages a lot of the youth. So there's a youth training component as well. So they have a contract with the local school. The culinary program buys all their produce. So they're able to cover their costs, and then they're able to donate the remaining produce to their community members. And another project we want to maybe highlight here is Squamish Nation. They have a pretty robust food sovereignty plan already. So they have a pantry, they have a food bank, and ultimately what we're doing is we're able to grow year round and supply those sort of initiatives already. And again, like the project I mentioned in Kuujjuaq, in northern Quebec, in Nunavik, what they're doing is they're working with the local co-op. So they're growing more culturally relevant crops, and they're able to sell it at their local co-op store. And they're also able to leverage some of the produce within the system to make donations to existing initiatives within the community. So there are tons of communities doing awesome work, and ultimately what we want to be able to do is leverage the learnings within the network and within all the community projects and be able to share resources, and that's what we're seeing with some of the community projects as well. So thank you so much for this opportunity, and I'll pass it over back to Marion.
Wow, that was a lot of information that you just packed in there. But first of all, tell us who we is. Like, come back in here, unmute yourself, and tell us who this we is, how we reach out to get some more solutions.
Yeah, no, that's awesome. So My name is Brandon. I'm with The Grocer. So The Grocer is a social enterprise that helps communities grow produce and food year-round. So we support, like I mentioned, with the planning stages on what to grow, how do we set up the project. We focus on the training component, so training the local community or community members to maintain the operation. And then we also maintain an ongoing relationship. So as social mandates change, for example, if the project initially was donating X amount of produce and you want to sort of increase that, or you want to venture into an economic development sort of opportunity, we're there to sort of support with that as well.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
I tell you, this was a really jam-packed informational session today, and I have to say thank you so much for all of that beautiful content. Thank you, Michael. Thank you, Abraham. Thank you so much, Lorraine and Branavan. That was absolutely beautiful information. So I do also want to say a quick shout out to Diane, Brittany, Andrew, Larry, and Gabriola. You are watching your credible, reliable information here on the FNHMA Town Hall. So I know we're really short on time. I'm going to go. Chief Lorraine, come back into the crow's nest. You want to unmute yourself. Chief, what are some of your final thoughts on this beautiful hour that we've had? What struck you? What's standing with you?
I think in terms of, moving forward and just, we got to learn to really work collaboratively. We need to share the information. We need to develop these partnerships and look at things holistically, right? And do what's best for all of our kids, our families, and build that resiliency in them. And a huge part of that is what we're putting in our bodies, but also what's happening up here, right? And from an Anishinaabe perspective, and making sure that we're communicating and teaching and sharing what we do with our Anishinaabe people right across Turtle Island, but incorporating that with the Western way so that it's inclusive, and we can harmonize those teachings, those learnings, even the food, right? Who says KD can't go with wild rice, or you know what I mean, or whatever it's going to be that day, or whatever we're growing. But to do that, because it's our kids, right? They're the ones that are going to lead us. They're going to take us into the future, and they got to learn to work, live, love, breathe, even argue, but do it together, right? And that's my final bit.
And that is going to be the words that carry us out. Thank you so much again for sharing your subject matter expertise, your solutions, and all of that love. So until next time, stay safe, stay well, stay healthy, and don't forget, food is medicine. Movement is medicine. Let's keep taking our meds, so to speak. Until next time, I say, hi, hi.